Deputy Presiding Officer, to ask the Scottish Government whether it still plans to launch a national care service in the current parliamentary session.
Minister Kevin Stewart.
Yes.
I thank the Minister for his optimism. I'm not sure that I share it. Following criticism from stakeholders and members of committees of this Parliament, the Minister is well aware of the huge practical and financial risks involved in the massive reorganisation of staff across care services, including the potential transfer of 75,000 local government employees to his centralised service. So is the Minister able to say whether the financial memorandum to the bill fully includes the cost of asset transfers, the full costs of two-pay transfer of staff, any resulting costs associated with pay, terms, conditions and pensions, and the impact of the application of VAT?
Minister.
I think that was a five-part question there, Presiding Officer. What I would say is that any spending decisions on the National Care Service will be backed by rigorous evidence-based decisions. And the costs in the financial memorandum largely represent investments in service improvements and terms and conditions for frontline care staff. And any insinuation, suggestion that the figures relate exclusively to admin costs are totally false. Beyond that, Presiding Officer, our 2022-23 budget confirmed more than £1.6 billion for social care and integration to lay the groundwork for the National Care Service.
Brief supplementaries, and that means a question. Evelyn Tweed first.
Around 1 person in 25 receives social care, social work and occupational health support in Scotland, and demand is forecast to grow. To what extent is establishing the National Care Service a precondition to ensuring we meet these future needs whilst delivering the consistent and high standards needed?
Minister.
Presiding Officer, we have been clear that we must design a National Care Service that is sustainable and future-proofed, taking account of the changing needs of Scotland's population. We have also been clear about the benefits of framework legislation in that respect. Legislating for the detail on a National Care Service in secondary legislation will allow our laws to keep up with the pace of population change and help close the implementation gaps that many of those folks who receive care and support say that we need to close.
And briefly, Paul O'Kane.
Trade unions, local government, professional associations, care providers in all sectors, carers and frontline workers are calling for a pause to the legislation, but they're also concerned that this legislation won't meet the aspirations of the Feely Review into social care. So can the Minister explain why he's failed to introduce key recommendations of the Feely report right now, such as ending non-residential care charges, which was incidentally an SNP manifesto pledge, and when will he listen to those stakeholders who have serious concerns?
Presiding Officer, Mr O'Kane missed out one key group that definitely wants change, and that is people. People who are in receipt of care and support, their carers and others are in favour of this, and that was shown in the consultation. I have to say to Mr O'Kane, the Government would like to do much more in terms of changing our social care system and providing greater investment. But that is not possible in the current financial climate. And it is a bit grim, the fact that Labour continues to support rule from Westminster, where Tory chancellors keep a firm grip on the purse strings and do not allow investment in our public services.
And question number